With the COVID-19 emergency order officially over in the U.S., we're reflecting on how the pandemic has impacted healthcare in America.
In tonight's HealthLink, Christine Pei looks at how the nursing industry has adapted.
A blue flag to recognize the difficulties of the past 3 years.
We have experienced a time that we hope we never have to repeat.
The nursing team at Multi-Care Good Samaritan Hospital in Puyallup gathering ahead of Nurses Appreciation Week to remember what they collectively went through.
We saw death and despair, and still, here we are today.
Farther north in Seattle at Providence Swedish Hospital's Cherry Hill campus. Ready to call the shots. A celebration to remember the incredible work that nurses do each day, pandemic or not.
It's been a bit of a roller coaster.
Bryan Benitez is a charge nurse at the Swedish Cherry Hill campus. He started here in 2019, pre-pandemic, and witnessed how the healthcare system changed forever when COVID arrived.
It definitely changed the way that we approached our care.
They dealt with a lack of protective equipment, a shortage of staff, and later patient pushback on restrictions.
We did see the backlash with masking and with a lot of the health restrictions that were placed on our community. But I would say on the whole, our nurses handled it in a way that we've always handled it. We just carried on.
Well, our nurses are really the cornerstone of healthcare. They're the
Renee Razzelier-Bomers is a chief nursing officer at the Cherry Hill campus. She says nursing shortages were already anticipated well into 2025. The pandemic only expedited that.
So we're seeing that shortage much sooner.
A shortage addressed with retention strategies like increased wages, mental health and well-being resources for their staff, and investing in schools to inspire students to become nurses. As staffing shortages persist, nurse practitioners are increasingly a part of patient care.
So we're trying to find models where we are maximizing our skill set to care for more patients with less resources. So nursing is a huge piece of that. Our nurse practitioners are definitely that.
Nurses, meanwhile,
from our side of the bed, we know that we are seeing you at the worst.
are asking for a little understanding.
Just knowing that we are here for you and just asking that you try to meet us even one step of the way.
The budget that passed in the state legislature includes funding for programs designed to grow the healthcare workforce, totaling $24 million. This is according to the Washington State Hospital Association. A portion of that money will go toward multi-state nurse licensing and increasing nursing slots in the community college system. For HealthLink, I'm Christine Pei.